You've been told that painful sex is just part of getting older, that dryness, burning, and discomfort are something you have to accept after menopause. But that belief is false. In fact, science shows us that what happens in your body at night, what you do before bed, can determine whether sex tomorrow feels painful or pleasurable. And here's the surprising truth. It has very little to do with hormones and everything to do with how you prepare your body, your circulation, and your tissues every single evening. As a gynecologist, I've spent decades treating women who feel frustrated, embarrassed, and sometimes even broken because of painful intimacy. Many of them were told to just use hormone creams, or to drink more water, or that this is just normal. But when we look deeper into the physiology, we see something empowering. Your tissues respond to daily habits, your blood vessels adapt, your nervous system recalibrates, which means painful sex is not inevitable, and you have the power to change it, starting tonight. Tonight I'll reveal 3 nightly habits, backed by both clinical evidence and years of patient success, that can transform your experience. These habits don't just mask the symptoms. They target the underlying biological reasons sex becomes painful: thinning vaginal tissue, decreased blood flow, and hypersensitive nerve endings. If you're tired of quick fixes that don't last, then stay with me, because by the end of this, you'll have concrete steps you can start before bed, steps that train your body to become receptive, hydrated, and pain-free again. Let's begin with something you probably wouldn't expect. Painful sex isn't caused only by dryness. In fact, studies show dryness is just one piece of the puzzle. The deeper reason is that the vaginal walls, after years of estrogen decline, lose collagen and elasticity. They become fragile, almost like skin that bruises easily. Add poor blood circulation, and the tissues can't plump, lubricate, or stretch as they once did. That's why applying lube alone often fails. The surface might feel slippery, but the deeper tissues are still stiff, inflamed, and hypersensitive. So the first nightly habit is focused on restoring blood flow, tissue repair, and hydration at a cellular level. And it starts with a ritual most women skip. Before bed, spend 10 minutes doing what I call vascular activation. This isn't exercise in the traditional sense. It's targeted movement that wakes up your pelvic circulation. Think of your vaginal tissues like a sponge. Without circulation, that sponge dries out. With circulation, it swells, softens, and becomes supple. The simplest way to do this is with 3 pelvic floor movements. First, gentle Kegels. Squeeze the muscles you'd use to stop urination. Hold for 5 seconds, then release. Do 10 reps. This activates blood flow in the pelvic basin. Second, hip bridges. Lying on your back, knees bent, lifting your hips toward the ceiling, then lowering. Do 15 reps. This pumps blood into the pelvic organs. Third, deep diaphragmatic breathing. Place your hand on your belly, inhale so your stomach rises, exhale slowly. 5 minutes of this reduces pelvic tension and lowers cortisol, the stress hormone that dries tissues and makes nerves hyperactive. Patients who added this 10-minute nightly ritual saw dramatic changes within weeks. Why? Because circulation is like irrigation. When fresh blood reaches the vaginal walls, it delivers oxygen and nutrients that trigger collagen repair. It signals your glands to produce lubrication naturally. It rebalances nerve sensitivity, so what once felt like pain starts to feel like pressure or even pleasure. But circulation alone isn't enough. That brings me to the second nightly habit: targeted nourishment of the vaginal tissue. And here's where we need to debunk another myth. Most people think hydration means drinking more water. While water is important, vaginal tissues need oils, specific plant-based oils that can penetrate and restore the lipid barrier. Without this barrier, the tissue cracks, loses elasticity, and becomes prone to micro tears during intimacy. That's why, before bed, I recommend applying a small amount of natural oil intravaginally, something safe, non-hormonal, and proven to integrate with the body's own lipids. Coconut oil, vitamin E oil, or even a medical-grade emollient are excellent options. But here's the key: It's not just about lubrication. Oils replenish the fatty acids in the mucosal membranes. They rebuild the protective shield that locks moisture in. They also contain antioxidants that fight inflammation. Critical, because inflamed tissue perceives touch as pain rather than pleasure. Imagine this. Every night as you sleep, your skin rejuvenates. That's when cell turnover happens most actively. By applying natural oils before bed, you're giving your vaginal tissues the building blocks they need right when they're primed to repair. Think of it as night cream for your most delicate tissue. Over weeks, patients report not just less pain, but more suppleness, natural lubrication, and resilience during intimacy. But there's a third piece we can't ignore, something most women never consider, and yet it's often the final barrier between them and a pain-free sex life, and that's nervous system recalibration. After years of painful sex, your brain forms a memory. Intimacy equals pain. This creates a vicious cycle. Even if your tissues begin to heal, your nervous system still sends danger signals, causing muscles to tighten involuntarily and nerves to fire excessively. To break this loop, you need a nightly ritual that calms the nervous system and retrains it to associate pelvic stimulation with relaxation instead of fear. This third habit is what I call neurocalming touch. Before bed, set aside 5 minutes for gentle, non-sexual self-massage of the pelvic area. The goal is not arousal, but relaxation. Use slow, light strokes with oil across the lower abdomen, inner thighs, and hips. Breathe deeply while doing this. The combination of touch and breath activates the vagus nerve, which signals the brain to shift into parasympathetic mode, the rest and digest state where healing and lubrication occur naturally. Patients often find this step the hardest because it feels awkward at first, but it's critical. If your nervous system remains in a state of guarded tension, no amount of oil or circulation will undo the pain. When you do this nightly, you rewire your brain-body connection. You teach your muscles to stop clenching, your nerves to stop misfiring, and your brain to stop anticipating pain. Over time, the loop breaks. What once was fear becomes calm anticipation, and calm anticipation allows desire to return. These 3 nightly habits, vascular activation, tissue nourishment, and neurocalming touch, work together like a triangle. If you do one without the others, you'll see partial results, but when combined, they reinforce each other. Circulation brings nutrients. Oils lock them in. Nervous system calm allows your body to actually receive the benefits without tension. Within weeks, many women notice sex feels less sharp, less dry, less dreaded. Within months, intimacy feels not just tolerable but enjoyable again. I know what you might be thinking. It sounds too simple, but simple doesn't mean ineffective. Remember, your body is designed to heal. These habits don't override your biology. They activate it. The problem is that most women were never taught how to maintain vaginal health after menopause. Doctors often prescribe hormones or lubricants, but rarely explain that the tissues themselves are dynamic, and that circulation, oils, and nervous system balance are the keys to restoring them. And here's the most important part. If you commit to these habits nightly, you don't just solve painful sex, you prevent it from returning. Because tissue decline isn't a one-time event. It's ongoing. But so is repair, if you choose it. Every night you practice these rituals, you're signaling to your body, stay alive, stay elastic, stay receptive. Now, let's dive deeper into why each of these habits is so powerful. Because when you understand the science behind them, you'll not only believe in the process, you'll be motivated to actually practice them every night. Let's start with vascular activation. Most women underestimate the role of circulation in vaginal comfort. Think about it. Your heart pumps blood to every tissue, but as we age, circulation naturally slows. Arteries stiffen, blood vessels narrow, and oxygen delivery decreases. In the vagina, this means the tissues don't swell, don't lubricate, and don't respond with the same softness they once had. That stiffness is what makes penetration feel like sandpaper, dry, tight, and even tearing. But when you consciously increase blood flow to the pelvis, you're doing more than moving blood. You're awakening dormant vessels. Inside your vaginal walls are tiny capillaries. Many of them collapse from disuse after years of low estrogen and reduced arousal. When you perform those nightly pelvic movements, you literally force those capillaries to expand. That expansion recruits new pathways for oxygen and nutrients to reach the tissue. It's a process known as angiogenesis, the formation of new blood vessels. Patients who committed to nightly vascular activation often describe their results in vivid ways. One said, "I woke up after 2 weeks and realized I hadn't felt that fullness in years." Another told me, "I felt a warmth during intimacy that had been missing for a decade." What they're describing is not imagination. It's the body remembering how to respond when circulation is restored. And here's a crucial detail. Circulation isn't only about lubrication. It also carries immune cells that protect against infection, fibroblasts that produce collagen, and growth factors that repair microtears. Without circulation, healing is impossible. With circulation, every tiny injury from past painful encounters can begin to mend. That's why vascular activation must come first. It lays the groundwork for everything else. Now let's revisit tissue nourishment through oils. You may be asking, why oils? Why not just creams or hormone-based treatments? Here's the secret. Your vaginal walls are made of epithelial cells that rely heavily on lipids, the fatty components that hold cell membranes together. As estrogen declines, your natural production of lipids plummets. That's why tissues become fragile. By applying oils, you're directly feeding those membranes what they're missing. Coconut oil contains medium-chain fatty acids, which integrate into cell membranes and make them more flexible. Vitamin E is an antioxidant that stabilizes those membranes and reduces oxidative stress, a major factor in tissue aging. When applied regularly, these oils don't just sit on the surface. They penetrate into the mucosa, strengthening it from within. Over time, women notice that the delicate skin of the vagina becomes thicker, more elastic, and less prone to tearing. Some patients worry about messiness or irritation. The solution is to use very small amounts, just enough to lightly coat the tissue. And always choose cold-pressed organic oils, free from additives. When done nightly, this simple ritual becomes as normal as brushing your teeth, and the results are cumulative. You're not just masking dryness, you're rebuilding your tissue, night by night. Let me illustrate with a patient story. Sarah, 58, came to me after avoiding intimacy for 2 years. She'd tried lubricants, but nothing worked. We started her on nightly vascular activation and intravaginal coconut oil. After 6 weeks, she reported her first pain-free experience. After 3 months, she told me, "I feel like my body belongs to me again." That's the power of targeted nourishment. It gives you back ownership of your own intimacy. But what about the nervous system recalibration, that third and often overlooked habit? To understand it, you need to grasp how pain works. Pain isn't just about tissue damage. It's also about perception. The brain decides whether a signal is interpreted as harmless or harmful. If you've experienced pain during sex for years, your brain wires itself to expect pain. This expectation triggers protective mechanisms. The pelvic muscles clench, blood flow constricts, and nerves fire more rapidly. It's a self-fulfilling prophecy. Breaking this cycle requires retraining the nervous system. That's where neuro-calming touch comes in. By gently massaging the pelvic area, by breathing deeply, by slowing your body down, you're sending a new message to your brain. This area is safe. This area is calm. Over time, your nervous system learns to stop reacting with alarm. It begins to associate touch with relaxation rather than pain. This is not theory. It's neuroscience. The vagus nerve, which runs from your brainstem through your chest and abdomen, plays a central role. When activated through touch and breathing, it releases acetylcholine, a neurotransmitter that lowers heart rate, relaxes muscles, and dampens pain signals. That's why 5 minutes of nightly neurocalming touch can undo years of conditioned pain. I once treated a patient named Linda, 63, who told me she clenched before intimacy without realizing it. Even when she wanted to enjoy sex, her body resisted. I taught her neurocalming touch. At first, she felt silly, but after a month, she noticed her muscles stopped bracing automatically. After 2 months, she reported desire returning for the first time in years. "It's like my body stopped fighting me," she said. That's the moment when intimacy becomes possible again, not just physically, but emotionally. Now, here's something important. These 3 nightly habits aren't just short-term fixes. They're long-term maintenance. Painful sex doesn't disappear overnight. It fades gradually as your body repairs, as your circulation improves, as your nervous system learns. But once you establish these habits, they become protective. They prevent regression. They ensure that as the years go by, you stay comfortable, confident, and in control of your body. And remember, these are not isolated steps. They work together. Without circulation, oils can't penetrate effectively. Without oils, tissues remain fragile despite blood flow. Without nervous system calm, the brain sabotages even healthy tissue. But together, they create a complete system. That's why I call them the triangle of vaginal renewal. So let's imagine your nightly routine. You finish your day. You set aside 15 to 20 minutes for yourself. You do 10 minutes of pelvic activation, Kegels, bridges, and breathing. You then apply a small amount of nourishing oil. Finally, you spend 5 minutes in neurocalming touch, breathing deeply, letting your body relax. That's it. 20 minutes a night. Yet those 20 minutes have the power to change the next 20 years of your intimacy. Many women ask me, "How long until I see results?" On average, most notice subtle changes in 2 to 3 weeks, less burning, less dryness, a sense of fullness returning. By 6 to 8 weeks, intimacy often becomes comfortable again. By 3 months, pleasure replaces pain. Of course, everyone is different, but I've seen this timeline repeat over and over. The key is consistency. Missing one night isn't catastrophic, but consistency compounds results. And here's a final truth I want to leave you with in this section. Painful sex is not just a physical issue. It erodes confidence, strains relationships, and creates silence where there should be closeness. But when you reclaim your body through these nightly habits, you're not just healing tissue, you're healing connection. You're opening the door to intimacy, laughter, and closeness that lasts. Now let's go even deeper into how you can put this into practice, step by step. Because theory is one thing, but what matters most is exactly what you should do tonight, tomorrow night, and every night after that. I want to give you precise instructions, so you're never left guessing. Let's start again with vascular activation. Remember, it's not about sweating or exhausting yourself, it's about stimulating blood flow where it matters most. Here's the nightly sequence I give my patients. First, 10 Kegels. Lie down comfortably, or even do them while brushing your teeth if that's easier. Squeeze the muscles as if you're stopping urine mid-flow. Hold for 5 seconds, then release for 5. That counts as 1. Do 10 reps. As you do this, notice the warmth or subtle tingling in your pelvic area. That's blood flow increasing. Second, hip bridges. Lie on your back, knees bent, feet hip-width apart. Press through your heels to lift your hips toward the ceiling. Hold for 2 seconds, then lower. Repeat 15 times. If you can, squeeze your glutes at the top for maximum circulation. This move isn't just for your backside. It's a pump that forces blood into the pelvic basin. Third, diaphragmatic breathing. Set a timer for 5 minutes. Place one hand on your belly, one on your chest. Inhale through your nose, letting your belly rise. Exhale slowly through your mouth, letting your belly fall. Focus on long, slow breaths. If your chest is moving more than your belly, you're doing it wrong. Adjust until your diaphragm, not your shoulders, does the work. That's it, 10 minutes total. But those 10 minutes set off a cascade inside your body. Nitric oxide production rises in your blood vessels, making them relax and open. Oxygen saturation in your tissues increases. Cortisol, your stress hormone, decreases. And this means your vaginal walls are literally being fed with life-giving nutrients while you prepare for bed. Now, once your circulation is active, it's time to nourish the tissues. This is where oil application comes in. But let's be specific. Which oil should you use? Coconut oil is the easiest, safest starting point. It's solid at room temperature but melts with body heat, making it easy to apply. It contains lauric acid, which has antimicrobial properties, reducing the risk of infection. It's gentle, non-irritating, and highly moisturizing. Vitamin E oil is another favorite. It's thicker, more viscous, and excellent for deeper repair. Vitamin E is an antioxidant, meaning it neutralizes free radicals, unstable molecules that accelerate tissue aging. When used regularly, vitamin E oil helps thicken the epithelial lining, making it more resistant to friction. Some women prefer almond oil or jojoba oil. Both are lightweight, rich in fatty acids, and absorbed quickly. The best approach? Experiment gently. Try coconut oil for a week, then switch to vitamin E oil the next. See how your body responds. Application is simple. Wash your hands. Scoop or squeeze out a pea-sized amount. With clean fingers, gently apply around the vaginal opening and just inside. You don't need to go deep. Half an inch is enough. The tissues inside will draw the oil where it needs to go. Do this just before bed, so the oil has hours to absorb while you sleep. One tip: wear breathable cotton underwear, or even skip underwear at night. Oils need air circulation to work best, and cotton prevents heat and moisture buildup that can irritate. Now let's address the final piece: nervous system recalibration. This habit is often the hardest for women to accept because it requires slowing down and touching an area associated with pain. But trust me, this is where transformation truly begins. Here's the step-by-step. After applying oil, spend 5 minutes with neurocalming touch. Lie down comfortably. With one hand, use gentle, broad strokes over your lower abdomen, hips, and inner thighs. Avoid direct vaginal contact at first. The goal is not sexual arousal, but relaxation. As you stroke, focus on your breathing. Inhale deeply. Exhale slowly. Say to yourself, "This area is safe." Repeat it silently with each breath. After 2 to 3 minutes, if you feel comfortable, place your hand over your pubic bone and apply light pressure. Hold for 10 to 15 seconds, then release. This simple action tells your brain, no need to protect. We are calm. If you experience tension, pause, breathe, and continue gently. If you practice this nightly, something remarkable happens. The clenching reflex, the automatic tightening that makes penetration painful, starts to fade. Your brain learns to release rather than brace. And once that happens, intimacy becomes possible without pain. You may wonder, is this backed by science or just anecdotal? The answer is both. Research shows that the vagus nerve, when stimulated by touch and breath, activates parasympathetic relaxation. Clinical data also confirms that pelvic floor hypertonicity, excess tension in those muscles, is a leading cause of painful sex. Neurocalming touch directly addresses this root cause. Combine that with circulation and nourishment, and you have a complete program. Let's talk about timeline again. In the first 2 to 3 weeks, most women notice subtle differences: less dryness, less burning. By week 6, tissues feel more supple, and fear of pain starts to diminish. By week 12, intimacy often shifts from painful to comfortable. After that, continued practice deepens results, often restoring pleasure and desire. And it doesn't stop there. These habits also improve urinary health. Many women over 50 struggle with urgency or leakage. Stronger circulation and pelvic floor activation improve bladder control. Oils reduce irritation that can cause frequent UTIs. Neurocalming touch eases pelvic tension that worsens urinary symptoms. So what you're doing for intimacy also benefits your daily life. But what if you've had painful sex for decades? Is it too late? Absolutely not. I've worked with women in their 70s who thought intimacy was gone forever. Within months of practicing these habits, they rediscovered comfort and even pleasure. The body is resilient no matter your age. Here's a quick recipe you can make at home. 2 tablespoons coconut oil, melted, 1 capsule vitamin E oil, pierced and squeezed out, 1 drop lavender essential oil, optional for relaxation, never more than 1 drop. Mix these together, pour into a small glass jar and let it solidify. Apply a pea-sized amount nightly. This blend nourishes tissue, fights inflammation, and signals calm to your nervous system through the lavender scent. Let's also address a question I often hear. What if I'm single? Do I still need these habits? The answer is yes, absolutely. Painful sex isn't just about partnered intimacy. It's about your comfort in your own body. Even if you never plan to be sexually active again, you deserve a body that feels supple, hydrated, and pain-free. And here's something fascinating. Many women who practice these habits while single later find that desire returns naturally, sometimes years after thinking it was gone forever. Now, let's talk about nutrition, because what you eat also influences your tissues. Remember, your vaginal walls are made of collagen, elastin, and lipids. To rebuild them, you need the right building blocks. Here are 3 simple dietary tweaks that support the nightly habits. First, omega-3 fatty acids. These are found in salmon, walnuts, flax seeds, and chia seeds. Omega-3s reduce inflammation and strengthen cell membranes, making tissues more resilient. Second, vitamin C. This is essential for collagen synthesis. Without it, your body can't repair connective tissue. Citrus fruits, bell peppers, and strawberries are excellent sources. Third, hydration with electrolytes. Plain water is important, but electrolytes help your cells absorb and retain that water. Coconut water, or adding a pinch of sea salt and lemon to your water, can make a big difference. Pair these dietary changes with the nightly habits, and you accelerate healing from the inside out. Another layer to consider is your relationship with stress. Chronic stress keeps your body in fight-or-flight mode, raising cortisol and constricting blood vessels. That's why diaphragmatic breathing and neuro-calming touch are non-negotiable. They don't just feel good. They actively lower cortisol, allowing your tissues to hydrate and repair. I want to share one more patient story because it demonstrates the emotional side of this journey. Maria, 55, told me, "I feel broken. My husband is patient, but I avoid him because I can't stand the pain." We began the nightly program. For 6 weeks, she reported no changes. She was discouraged, but I encouraged her to stay consistent. Then at week 7, she wrote in her journal, "I felt moisture today without lube for the first time in years." By week 10, intimacy was comfortable. By week 12, she said, "I finally feel like a woman again." Her words capture what's at stake here. Painful sex isn't just about the body. It's about identity, connection, and confidence. And when you take ownership with these nightly habits, you reclaim all of that. So, let's put this into perspective. In just 20 minutes a night, you're addressing circulation, nourishment, and nervous system balance. You're preventing micro-tears, restoring lubrication, calming nerves, and rebuilding collagen. This is not a quick fix. It's a transformation, and every night you practice, you're building a foundation for years of comfortable, confident intimacy.